Hi, I'm Dr. Mirrafati from Mirrafati. Last week, I had my friend Maui, who is the engineer and CEO of this laser company, and we went over the parameter of this laser. You can check out the other video that we talked about it. But the interesting thing is I went skiing over the weekend, and I do have a bad knee, and it's pretty much bone on bone. And today I couldn't walk all day, and now my day is over. And I'm going to try this laser on my knee to see if it truly reduces the inflammation, the pain that I have with my knee right now. It might not be the best example of this because truly my knee is bad. It's truly bone on bone, and have to get knee replacement. But for meanwhile that I'm scheduled for knee replacement in about a few months, I'm gonna try this laser to see if it does truly reduces the inflammation in a worse scenario than if it does this. And if I do experience the relief of pain and some inflammation because I can't really bend it beyond this point, then it might be something good for ordinary sport injuries or people that don't have as bad of a knee or maybe elbow or wrist pain. It might do really good. Basically, this laser machine I'm right on the knee, but you can use it for other areas as well. I just basically pick the knee because that's what I'm going to do. But as you can see, you can pick ankles or the wrist or elbow or shoulder or even the back, multiple other areas. You can actually use this laser machine and keep it on safety right now. So you can see that I basically changed the parameter in here. So this laser has two wavelengths, right? It has the 810 wavelengths nanometer and 980 nanometer wavelengths. 980 is for deep. So I have bone-on-bone issue with inflammation. So normally we keep it at 10. I brought it up to 3. And I can feel some inflammation superficially. So the 810 nanometer is for superficial, right? So I brought that to 3. So it gives it a little bit more energy or kilojoule of energy. I like to keep it on pulse. There's two parameter in here, continuous wavelengths or pulse. I think pulse is better for reducing inflammation because the pulse width is for 10 milliseconds. So for 10 milliseconds, it's producing the energy. And for 10 milliseconds, it relaxes the energy. So it kind of go back and forth. So, and then I'm putting it for 8 minutes, but obviously I'm not going to have this video for 8 minutes, me just doing it. But to show it, I'm going to lean back, obviously, and I'm going to put it on from the standby to basically, let me see. Oh, I haven't turned it on. So then we put it on standby, right? So now it's ready, right? So it has another safety feature, which is this red button. Now, once I produce the red button, I'm going to put 8 minutes on both sides, and I'm having this side go back and I'm hitting it. Now I can feel the heat, and you can basically see the energy joules gathering up as it gives through that 10 millisecond on and off. The energy joules is keep going up until it reaches that parameter of the energy. And we're obviously doing it for 8 minutes. Now I'm going to do it 8 minutes on this side and then 8 minutes on this side. You can pretty much see the inflammation on my knee right here, the fluid that's there. And hopefully this will help some of the inflammation. And then I can talk about it tomorrow and saying how well it did or if it did not. So this is a good test that I'm doing on myself. So I guess I'm not going to bore you with more information than that, other than the fact is I'm going to keep it for 8 minutes on this side, and I'm moving it around to the whole area on the side of the leg. And then I'm going to do the same thing on this side, total of 16 minutes at least for the knee because it has two sides of inflammation. That's about it. So stay tuned, and be back tomorrow to kind of go over to see if I really did feel some pain, some relief of pain overnight or not. Thank you.